Let's get serious about fixing knee pain. We're gonna give you clear instructions on exactly what you should be doing, the easy stuff, so that we can really understand and make better decisions about our knee so that we don't have these chronic injuries keep coming up. The main thing that we wanna do right here in the beginning of the video is talk about the anatomy. What is the anatomy and the biomechanics? If you understand that stuff, you're gonna be able to make really good decisions about how you load your knee. In Western medicine, we're defining the knee wrong. We're isolating it. We're saying, hey, I'm a specialist in just knees. But really what we need to look at is, what is the knee? The knee is a connection between the femur and the tibia. So we've got to pay attention to what's happening at the top of the femur and what's controlling this bone and what's happening in the tibia at the bottom. So when we're thinking about range of motion and movement, we need to think about how much movement the hip does. It does a ton of movement. And then the ankle does a ton of movement too, right? So we have a lot of range of motion right there. And then our knee goes forward and backward. It has a little bit of a 5-degree twist. They call it the screw home mechanism, but for this video, it's really not that important. We just need to think that the knee is a consequential joint. It's dealing with what the hip and the ankle give it. And so we've got to address those things. So if you're thinking about your knee as what's happening to my femur, what's happening up here at my hip, what's happening at my ankle, then you'll really be able to dive into this information and make it actionable really quickly. When we're addressing knee pain, we need to take a 3-dimensional approach. We need to be thinking about what's happening below the knee, what's happening above the knee, what's happening behind the knee, and what's happening on the front of the knee. So the way that I think about it is, if I have a fray, if I have a tear in a muscle or irritation, like a tear down here, a sprain, strains, then if my shorts, let's say that's my shorts or these muscles, if they're really tight and being pulled right here, and I have a little tear on this side or a tear at the bottom, I need to loosen up just below the tear. I need to loosen up above the tear, especially where muscles are overlapping. That's where they tend to get stuck together. And then we're also thinking about the back of the knee. If I pull on my shorts like this, then I've got pressure pulling on the front of the knee. So it's really important that we address the back of the knee and we loosen that up, so we get that 3-dimensional approach to loosening up the knee so that we can load other areas and we allow it the time to heal. Before we get into the next section, go ahead and hit the subscribe button, hit the bell icon. We're posting a lot of information on exactly how you can fix these things on your own at home. You're gonna make a lot of progress when you're following this channel. So go ahead and hit the subscribe button so you don't miss out on it. The bell icon, I think, gives you notifications when we post a new video. And these are all gonna be sequential. Why stretching alone doesn't work? If you think about your muscles like a pulley system or a rope, if you tie that in a knot and I just pull on the knot, it just makes the knot tighter. Now, in our body, we have a lot of biology going on. We have a lot of healing molecules down there. So we've got to just give it the ability to heal. And so where we have a corkscrew, where we've tightened up right here, and so we've created that tension, we need to loosen that up. And there's a sequence of doing that. We need to break down that tissue, we need to increase blood flow, and then we need to lengthen the tissue. And not just in one spot, we want to loosen a chain of tissue. And we're going to go through that pretty consistently through this video and the subsequent videos as well. It's a lot easier to understand the knee when we start thinking about it like a pulley system and start thinking about it like a rope. Now, what happens when we have these little tears and this irritation is it's like a frayed rope. We want to take that load off of that frayed rope. So an easy way to look at it is, if this is a ledge coming out here and we got a little guy hanging off the edge of this ledge. This is a pretty sharp ledge. And so if that rope is moving around, it's causing irritation right here, and that's gonna start to fray that rope. Now, if I'm back like this, then it's flatter and it's not putting as much pressure on it. So getting our knees over our toes, there is a stage in knee rehab where we make the body more resilient, and loading knees over toes could be a good thing. But in the beginning, if you're having pain, stay away from knees over toes. A really good test to figure out if you're loading your glutes, if your glutes are firing really well, is to do a squat in 2 different ways. So the first one, when I come forward, it's a knee heavy, a knee dominant squat, is that I'm coming down like this. Now I can poke on my quads. If this causes you a lot of pain, back off a little bit. You don't have to go down that far to feel those quads kick on. 90% of our clients that come in with knee problems, their quads are over dominant and their glutes don't fire enough. So you can confirm this fairly quickly. So I'm just gonna go about 20% of the way down, and I see that these muscles are really tight. The further I go down, don't do this part, but the further I go down, the more I've loaded up that quad. Now my glute, I can poke into it. It's working, but I can poke into it. That's a good way for you to test it. If you can poke into your glute and it's not activated at all, then the glute's not doing any work. Now I want to change the second part of this is that I'm going to shift. I'm going to allow my chest to come down and I'm kicking my butt back. My weight's mostly on my heels. And now I poke my glutes and I fired them up because of my angle against gravity. When I'm poking here, I can also poke right here and I can push right into that quad muscle. It's not doing very much work. So that's a good way to check if your glutes are fired up enough, because one of the things that we're going to be working on is how to get our glutes fired up more and take that stress off the knee. Another really important concept to understand is with walking, what positions our joints need to get in, right? We talked about the hip, we talked about the knee, we talked about the ankle. If we aren't getting 10 degrees of dorsiflexion, 10 degrees of bend at our ankle, then when I go through mid stance, my knee's gonna have to bend early, and then I'm gonna have pressure on it and I'm gonna have that pull from the quad. If my knee can't get straight because it's inflamed, then that's something I need to get back fairly quickly, because the knee being bent is still gonna put more pressure on the knee while we're walking. And then also, if I don't have, we call it triple extension, and that's where I push off of my toe, my knee is an extension, and then my glute is firing. So when we're walking or running, we're getting triple extension, and that's the healthiest way to load our body. We need to be using our glutes. We always want to redistribute pressure up to the more proximal muscles, the bigger muscles in our glutes, especially with lower extremity, we're getting up to those glute muscles. So that triple extension is that I'm pushing into plantar flexion, which is essentially extension, and then my knee's totally straight, and then I'm firing my glute. And by doing that, I'm taking stress off the knee while I'm walking. Okay, our first easy exercise that we can be doing is rolling out our glutes. We need to loosen up that glute tissue. We always attack an area where muscles overlap because they tend to get stuck together. So I'm gonna do it against the wall. If you want a video on how to progress this and how to put more pressure and break up more of that tissue because this isn't hard enough anymore, then go ahead and leave a comment and let us know that you want to go through those progressions and that you're ready to do it now. So I'm gonna get up against the wall. So I wanna be right here off to the side. This is where my glute max, gluteus medius, and gluteus minimus all cross each other, and they typically get stuck. You'll feel a knot right there, and it will be tender, and we want it to be tender. So I'm gonna put it here against the wall. So right off to the side, there's a bone right here, there's a bone right here. I wanna be just in the middle, right around your belt loop. And then I'm gonna drop my weight down into it a little bit, and then I'm gonna unweight this right leg. So all my weight's on my left leg right now. And if I'm gonna move around, it's only gonna be about a half an inch. And I'm just moving back and forth. I don't wanna wiggle in my back a bunch. But all I'm doing right here, this is the first thing that we do, and it's sequenced properly because I want to loosen up those glute muscles so that I can use them more effectively. So I'm just moving back and forth. We're going to do that for 1 minute. The second thing we're gonna do is a hamstring rollout. So we loosened up the glutes. Now I wanna take some pressure off my hamstring. So, and if you look right here on my hamstring, the hamstring comes out and it bifurcates. It splits across right here and then crosses the knee. So I wanna loosen up right here in this muscle belly right here. So what I'm gonna do is I wanna get on a hard surface, so a chair. Really doing it on your countertop is probably the best place to do it. But if it's hard to get up and down, just get on a hard chair right here. And I'm gonna kick my butt back as far as I can. I drop this down right here. It should be tender as well. And then I'm just straightening the leg out. We don't have to get the knee totally straight. What I do want to do is make those muscles straighten out and shorten and glide around while I'm putting pressure on them. If it's not causing you any tenderness, any pain at all, then I want to go ahead and put my hand down right here, and I'm putting pressure down into the lacrosse ball and maintaining that. I'm gonna go through this in 3 different spots for 10 extensions, 10 swipes. So now I'm gonna do it on the inside for 10, I'm gonna do it in the middle for 10, and then I'm gonna do it on the outside for 10 right here. And I'm gonna show you one more time exactly where you wanna be. We're right here on the inside, right here on the middle, and right here on the outside. And that's just where more of the muscles cross each other so that you can loosen that up and take that stress off the back of the knee that's starting to compress on the front. The third thing that we're gonna do, the easy exercise to start getting some of the stress off your knee, is doing a hip hinge squat. We're gonna work on a hip hinge. We always need to be practicing this because we should be moving through our hips, not our low back too much, and not our knees. If our hips aren't strong, then our knees tends to dip inside and we put pressure on it. The weak spots of the knees are the inside and the front. So what we want to do is push off of that hip. So to do that, I'm going to do a hip hinge squat. I'm going to be loading my hamstrings and my glutes. So I can do it against a wall right here and do reps, but I'm going to show you right here against the chair. So I'm going to get about my foot length. So whatever your foot length is, that's where we want to start. So my foot length away from the chair, about where your toe is inside your shoe. I keep my face in line with my chest and I'm reaching back with my butt and I'm touching right there and I'm coming forward. This isn't a down and up movement as much as it's a backward and forward movement. So I'm allowing my chest to come down, pushing my butt back, loading those hamstrings and my glutes. I can feel that tension through my hamstrings and then I'm pushing forward right here. This should not cause stress on your knees. So I'm pushing backward, pushing forward, coming up. Most of my weight is on my heels right there. You do this for 2 to 3 weeks and you're gonna start feeling it in your glutes a lot. And that's what we're looking for. We're looking to load the glutes more, load the hips and redistribute that stress and that pressure up into the larger muscle groups. That'll take stress off your knees. If that exercise causes you problems and gives you knee irritation, then you're likely not doing it right. You're allowing the knee to go forward. And that's what we see here in the clinic. When people are allowing that knee to go forward, they're stressing the knee too much. So we want to keep like a stake driven into the ground. We want to keep this tibia totally vertical. And so I'm coming back, this stays vertical and I come back up. So the hips are pushing back and I'm allowing the knee to bend. I'm just not allowing it to go forward. And so that, just changing that movement pattern alone is going to help you a ton when you're getting up, moving around, sitting, like getting out of the car. All of those things are going to be much easier for you when you fire up your glutes more and take that stress off your knee. How often should you be doing these exercises? If you are in a pain pattern right now, if your knees are irritated, we should be doing it at least twice a day, if not 3 times. It should take you less than 6 minutes, 5 to 6 minutes to be able to do this. You roll out the glute, you roll out the hamstring, and then we work on our hip hinges. We want to do 2 sets of 15 and as consistently as possible. You're going to be feeling better within a week. In 2 weeks, we should be feeling really good because we're not going through those really bad patterns. Now, it's always easier when people come into the clinic, but these are home exercises that we work with clients with all the time. You've got to master that hip hinge, but doing it consistently. The only way you're going to improve with these movement patterns and with the tightness in your muscles is if you do it on a consistent basis. If you want more information on this, go ahead and hit the subscribe button. What we want to do is show you these positive things, what you should be doing to help yourself. But we also need to show you the things that you need to avoid. So if you hit the subscribe button and that bell icon, it'll give you a notification because we're going to put up consistent videos. And this is going to be a really important one when we talk about what to avoid with the knee. The way that I think about it is cigarettes. If I'm smoking cigarettes and then I can take supplements for my lungs, well, if I just took away the cigarettes, then I'd probably have much better lung health than adding a supplement. And that's how it is with the body. If we can take away the negative things that are happening to it, we're going to have significant improvement. And we want to balance those scales. We want to do some positive things, but we really want to take away a lot of the negative things. So the next video about the knee, we'll be posting that. So we appreciate your time. See you in the next video. Get mobile and stay active.